Hello, all. My name is Gina Harris. I do want to apologize if my voice is a little raspy or I cough. I'm coming to the end of having COVID, or at least what I hope is the end. Um, but so we'll get started. Today, we are reviewing a brief case study of Mr. Stein. Mr. Stein is a 34-year-old investment banker, husband, and father who presents with symptoms that strongly align with generalized anxiety disorder, or GAD. We will work we will walk through his symptoms, the DSM-5 or diagnostic criteria, and the risk factors, and a recommended treatment modality. Mr. Stein reports experiencing what he describes as a nervous breakdown. Over the past year, he felt chronically keyed up, agitated, and increasingly irritable. He also reports difficulty sleeping, stomach upset, and problems with concentration. According to his wife, he often tosses and turns at night and wakes up frequently. So she shares concerns about his recent tendency to yell, even at their young daughter. Mr. Stein has always been a worrier, even back in college. He consistently second guessed his decisions, such as where to go on a date, whether his car would break down. Though extroverted and driven, his perfectionism and his constant anticipatory anxiety have followed him into adulthood. These seem to appear These symptoms appear to have intensified over the past 6 to 12 months, possibly triggering by the near bankruptcy of his company and his parents' separation, both of which occurred 3 years ago. Based on the DSM-5 criteria, Mr. Stein meets the diagnostic threshold for generalized anxiety disorder, moderate. He meets criterion A, which requires an excessive anxiety and worrying to occur more days than not for at least 6 months. He also meets criterion B, which states that the individual finds it difficult to control the worry. Mr. Stein exhibits 5 of the 6 symptoms required under criterion C, including restlessness, fatigue, difficulty concentrating, irritability, and sleep disturbances. These symptoms cause clinically significant distress in his family and occupational life. Satisfying criterion D, medical conditions have been ruled out, and no other mental disorder better explains the symptoms, fulfilling criteria E and F. Several risk factors are evident in Mr. Stein. He appears to have a predisposition to anxiety, possibly related to high familial expectations, environmentally ongoing work stress, parental conflict, and marital strain. Excuse me. May be contributing to his condition. Additionally, while he does not currently misuse substances, his use of alcohol to self-soothe could become problematic if left unaddressed. His perfectionism tendencies and fear of failure also reinforce the cognitive patterns that maintain his anxiety. For Mr. Stein, the recommended modality is cognitive behavioral therapy, or CBT. CBT is evidence-based approach that helps clients identify, challenge, and reframe maladaptive thought patterns that contribute to anxiety. In therapy, Mr. Stein would learn cognitive restructuring techniques to address the catastrophic thinking, relaxation, and mindfulness to exercises to reduce somatic symptoms, behavioral strategies like worry time schedule and sleep hygiene. CBT is particularly effective in GD cases where the client is motivated, insightful, and goal oriented. All the characteristics that Mr. Stein seemed to possess. If symptoms persist, a psychiatric consultant for SSRIs may be considered. The conclusion that Mr. Stein's symptoms align closely with generalized anxiety disorder as defined by the DSM-5 through CBT and possible medication, he can learn to manage his anxiety and regain control over his emotional well-beings and relationships. Thank you.